Hi, welcome back everyone. Ken Vitale here. This is that video that I was referring to before, the high yield overview of all things orthopedics for USMLE Step 1. We're going to cover key topics, mechanisms, medications, anatomy, plus some clinical pearls to help you connect the dots between board prep and real world medicine. So let's get. So this presentation is clearly designed to complement your current ortho or PM&R elective if you are doing one, or if you're just preparing for Step 1 in general. So the topics that we're going to cover aren't just board relevant, they are foundational for all forms of clinical reasoning. So let's start with bone pathology. Know the stages of fracture healing. They love to ask these questions, starting with hematoma, followed by callus formation, followed by remodeling. Be familiar with those high yield fractures like scaphoid fractures and supracondylar fractures of the humerus. Of course, bone tumors are very tough to know, but there are a couple very key high-yield ones like osteosarc, Ewing's, and chondrosarcoma. For example, going back to the scaphoid fracture, you might ask, right, why is a scaphoid fracture so high-yield? It's because it's often missed on initial x-rays, and if you have knowledge that it's high likelihood, high suspicion that it's going to happen, you remember, that might be a scaphoid fracture, let's put you in a brace or cast, repeat the x-ray 2 weeks later, and sure enough, the fracture appears. So early detection is key. Next, muscle phys, excitation-contraction coupling, favorite Step 1 topic, right? All things calcium, troponin, tropomyosin. Also understanding neuromuscular disorders, they love to quiz this, like myasthenia gravis, Lambert-Eaton, even though it's not commonly encountered unless you're in a real niche neuromuscular disorders clinic. You're likely not going to encounter these patients very often, but they love to quiz them because they're such classic pathophysiology questions to ask. Next, another thing they love to ask is connecting the dots, going from the knowledge of anatomy onto the injury of the nerve, onto the pathology and what presents on exam. So upper and lower limb nerve injuries are just classic Step 1 material, right? So wrist drop, think radial nerve. Trendelenburg gait, think superior gluteal nerve. So a neat thing that you can do is match each gait abnormality to its corresponding nerve injury, like listed here in this presentation. That can be a nice help. Pharmacology, this is a big one. It is dense but manageable. Know your NSAIDs, your DMARDs, your biologics, and importantly, your osteoporosis meds. They love to ask those. So stop and ask yourself, right? What's the difference between methotrexate and biologics in RA treatment? These are classic questions to ask, because if you have a patient with RA that's been on methotrexate for years and isn't improving, if you switch them to, for example, a TNF inhibitor, that can change everything. Joint pain and fatigue can just dramatically improve, and they can get so much better. So it's very important, very high yield, and asked very commonly. What's the most high yield form? Because that previous slide had a ton of things. Pain meds, DMARDs, bisphosphonates, and steroids. They often show up on exams and in clinic. That's why they're tested so much. Again, same thing. If you stop and just think, right, quiz yourself. Pain meds, okay, why is acetaminophen not considered an anti-inflammatory, but it's often covered in the pain med category? These are good things to think about and quiz yourself with. Okay, know your regions, right? That's the next thing. ACL or PCL injury in the knee, rotator cuff in the shoulder, a SCIFI in the hip, carpal tunnel in the hand. These are very key classic conditions that they love to ask questions about. I haven't seen as many of these specific questions, but they do come up here and there, like the knee ACL and the hand carpal tunnel are pretty classic. Pathophysiology. This is great because this is so high yield, since you're going to see it in all other areas that you're studying for, right? The inflammatory process, RA and gout, infectious, metabolic, degenerative. These mechanisms can help you very easily categorize diseases, and it's really going to come up in a lot of other questions. If you have a neoplastic process, if you have a vascular issue, very, very useful. Now on to joint and soft tissue disorders. Right? The classic is RA versus spondyloarthropathy. Seronegative is basically what we're talking about here. Gout versus pseudogout. Right? Know your crystal types. Know the joint involvement. Right? The stop and think question here is What's the key difference in crystal appearance between gout and pseudogout? That can be very helpful, and it's a common buzzword that's asked on the boards. On to PEDS. These are all a lot of acronyms here. DDH, developmental dysplasia of the hips. SCFE, slip capital femoral epiphysis. Clubfoot. These are very high yield, and they are often seen in clinic, granted in PEDS clinic, not in adults. And these are good things to ask yourself, right? Why is SCFE more common in certain adolescents versus others? There are reasons for that. As you study, you're going to learn it, and then hopefully that'll help you retain it when it comes to exam time. Now, lower yield for step 1, but still high yield in clinic is imaging interpretation, right? Know which modalities used for which condition, right? So X-rays are really clearly for bones, MRIs for soft tissue, ultrasound also for soft tissue, but more for things like soft tissue trauma, looking for tears of a tendon. CT is used for guided injections, ultrasound is used for guided injections. Again, this is getting a little bit beyond step 1, but it's important to know nonetheless. So summarizing, this slide really ties everything else together, right? Combining multiple concepts and multiple issues that you're going to have to study for step 1 into a single disease is great. Going from fracture healing to arthritis to tumors to pediatric conditions. If you can go through the process of, for example, Paget's disease or septic arthritis, you're going to tie in a lot of concepts that's going to help you in a lot of other questions in step 1. So I'm going to summarize and end here. During your elective, look out for these conditions when you're in clinic and when you're in the OR. Right? Practice your physical exam, ask questions, focus on patient care, and try and look for these step 1 questions in clinic, because you're going to remember that patient and you're going to remember it on the boards. Good luck.